Thank you for joining us. Um, so we can probably go through this fairly quick today, and get everybody back to their other work. But yeah, so the healthcare sector meeting, just kind of updating us on what the implementation groups are doing, and right now we basically got two that are running. So the first one is the Just Walk, or Walk with a Doc, whichever way you want to call it, group. And Katie has been in charge of that. So if you want to give the update on that specifically, then I
Yeah,
think that makes the most sense.
absolutely. So we have two walk locations, one in Missouri and one in Kansas. Our Kansas location is over in Shawnee. During warmer weather, we hold it at Mill Creek Streamway Park. And during inclement or cold weather, we're usually indoors at Mill Creek Activity Center, which is only about like half a mile away. It's not far from the actual park itself that we host our walks. But I'm going to go ahead and give a quick update on Missouri, then we'll move over to Kansas. Missouri side, we're still trying to figure out, just based off of how last year went, where we would like to host these walks or if we will continue. So last year we were at Chris Harris Park. We didn't have the greatest participation. So this year we wanted to gather some community feedback. So I went ahead and I attended the Ivanhoe Neighborhood Association meeting, which was last Saturday. I kind of explained the program and what we were offering and just kind of the information I wanted from them. And I only had two residents fill it out. One was interested in having walks, one was a maybe. So just based off that information, we're still kind of up in the air about whether or not we'll continue or where. The things we're going to offer to Ivanhoe at this point is either connecting them to UMKC walks at Southeast Community Center, or if they can garnish 10 residents or community members' interest in having a Just Walk event, then we'll reconsider continuing hosting over in Ivanhoe. Or the other option is that when they have events, which they have many programs and events at the community center itself in Ivanhoe, like on a weekly basis. So they've got an Earth Day event coming up. They have a seed exchange event coming up. They have cleaning parties regularly. So we could always offer a healthcare professional to come out specifically during events and doing like an impromptu Just Walk event then. But that's where we're at on the Missouri side. Shelly, did I miss anything?
I don't think so. I think the one thing we need to do is the Just Walk group meets second Tuesdays of the month. The next meeting will decide whether or not we're going to continue. We're supporting the Missouri side walks because there is a cost associated with that. And so far, we've only hosted, let's say, half a dozen walks on the Missouri side. And so we're paying to host walks without hosting walks. So
so as Shelly mentioned, we do meet the second Tuesday of the month. So our next meeting is actually coming up here shortly. It's March 12th, and it's at 8:15 a.m. At that time, we will discuss the Missouri walk location as well as our Kansas walk location. So we actually have a Just Walk event coming up on the Kansas side, which is this Saturday. So it is March 9th at 9:30 a.m. It will be held outside. So it'll be at the park itself, not the activity center. We still don't have a healthcare lead, which is fine. I will be attending, but that is something we have been having challenges with, is having volunteers. This could be due to the distance. Maybe it's not close enough to some of our staff. So that's something we'll be bringing up at our next Just Walk meeting as well. But that's all of my updates for Just Walk.
When
Yeah, I
and
mean-
where is that next one?
So it's March 9th. It's over at Mill Creek Streamway Park. Give me a second. I can drop in maybe. I had a map pulled up earlier of our park. So I can drop the address here
And
in a
what-
second.
And what time is it?
It's at 9:30 a.m.
I may be able to stop by that. I may be at the Sojourner Free Health Clinic that day, not sure yet, but that doesn't start till 11:15, 11:30.
Well, if you'd like to join, that would be great. I'll be there.
Awesome.
Yeah, and we do have some incentives this time around. Just provide to like maybe the first 5 people or so. They're Children's Mercy branded, but we've got like the stress popper things. I don't know what they're called, but I know they're for like anxiety. I said stress. I think it's anxiety. Do you guys want to talk about those like bubble
Fidgets,
popper?
the fidget
Yeah,
bubbles.
it's like
Yeah.
a fidget thing. Yeah.
Fidget
And
bubble.
then fidget bubble. I've only seen them, but they're fun. And
My
then,
kids have one.
so you know what they're all about.
Yeah.
And then we've got like water bottles, some bags, pins, bubbles, just some like small things that we can go ahead and hand out and try and attract more participation by offering some of these incentives.
That's
As
a
far
great
as
idea.
the talking part, is there any guidance on what to talk about, or just kind of see what people are interested in chatting about?
Yeah, I mean, the idea was that it was like a little 5 to 10 minute sort of health talk on, maybe why physical activity is good, or, talk about healthy eating, or just ideas on, hey, we're doing walking, but things you could do during the week for strength training or something like that. Just simple little
Mhm.
tips, nothing too in depth, very, very lay person kind of level. So,
Mhm.
yeah, but I mean, if you get there and somebody's got a question, you can just roll with it too. That's perfectly reasonable.
Sure. So, is this something where I can just kind of keep as a possibility on my calendar and show up or not show up, or you need a commitment ahead of time, or?
Because I'll be there, I don't think we need a commitment. But Ed, what I'll do is I'll send you a calendar invite and I'll include my phone number. So if you are able to make it, if you just want to send me a text or you can email me, that's fine. If I don't hear anything from you, I'll just assume you're not making it. Is that okay?
Okay, perfect. Yeah, I'll try.
Awesome.
Yeah, I'll try to get back to you one way or the other, but I need to check with my wife and check with Sojourner Clinic and see what's going on. But I'll let you know.
I appreciate. Have you ever been out there at Mill
Where
Creek?
is it again? Sorry, Mill
So it's
Creek.
it's over in Shawnee. Well, either way, if you want to bring your family, you should. It's a beautiful park system. There's ample amounts of trails. It's great for biking, walking. It's dog friendly. There's different playgrounds and stuff. It's just an overall beautiful park system. So
Cool. I would probably bring my trail bike if I come over.
yes, it's perfect for that.
Great.
Nice.
Okay.
I will be just skiing at that moment in time, so I will not be around. Walking in heavy boots. Well, thank you for that update. The next one is well, we got the billing, but that's on hold for now. So there's no update there. But the
So
next one,
I will I will throw
Maybe
one
that's a
thing
lie.
in here for consideration. Yeah, we are, that group is a very heavy lift, as some of you may have experience with. Our initial intent was to learn a little bit about coding and billing related to physical activity assessment and counseling, and using some of the codes that already exist to get reimbursement. Children's Mercy is probably not the best institution to move that forward because of the way our billing system is set up for non-medical providers. So for our exercise physiologist, registered dietitian, some of those in allied health, there's not an individual charge sent out for those visits. There's a facility fee that's charged in order to keep the cost to the patient manageable and covered by insurance. And so there have been a number of roadblocks when the person who was leading this group was trying to move it forward. So for us, for this sector, we're putting that on pause. There's not going to be any additional movement until we can identify a group of individuals who might have some experience using remote patient monitoring, not just for the purposes of research and monitoring, but including billing as a component with that. So using it from a treatment perspective and billing. There is national work going on nationally to move this forward. There are probably some groups nationally who are having some successes. We're just not well connected with them yet. Until we are, I think we're gonna, if the group agrees, we are probably gonna remove that from our updates since we don't have any updates right now, and we won't update and get that group going again until we have some additional movement or individuals in the local area that have some experience.
I think that makes perfect sense. Yeah. Okay, so the
It
curriculum.
looks like Dr. Kramer's talking, but I think he was on mute.
Oh, no, sorry. Still on mute.
Okay, I'll put you guys on a back screen somewhere. I know I've mentioned the name David Moran before with University Health, and he is all but retired, but he's still at least, some small part-time working with University Health. He knows a lot about coding and billing. He knows a lot about electronic health records. He used to work for Cerner years ago. And does that name ring a bell to anybody that I've mentioned? I think I might have even said, hey, I'll reach out to him, but
Say his name again.
David Voran, Voran. I'm going to copy his address and paste it. In the chat here, at least I've got his UMKC address. He's also got a University Health address, but I think he has responded to this one. So there's his UMKC address. If you want me to, I can dig up his University Health address while we're talking. Yeah, David.Moran. I'll type that in too. David.Moran at UHKC. I think that's .net. So anyway, rather than make empty promises, somebody could reach out and say, hey, Dr. Kramer said you might be interested in helping out with this. And I know I've connected him with this program in one capacity, and that had to do, I think, with remote monitoring. So if you look for your emails, you might find something with David Varan on that, blood pressure monitoring, wearable devices, things like that. So it wouldn't be a cold call necessarily. And you can
Yeah.
copy me on, if you copy me on an email address, I'll just chime in and say, hey, thanks, David, for helping out.
Okay. And
Yeah, I
use
think I
either,
remember you
use
talking
both
about
of
that.
those emails?
I would probably just use them both and see if he replies to one of them. They should
Okay.
both be valid, you know, it's just a question of which one people look at more often, or if he's probably got them combined because he knows how to do that stuff.
Yeah, I mean, that would be helpful, especially if they've figured out ways to bill. I know that's something that we've been looking at Children's Mercy a lot with our athletic trainers and stuff like that. Being able to get some fee for their services, but the hospital doesn't really want to jump into that, from what we can tell. So that makes it hard
You
to
would think
test
they
it,
would.
you know. They don't want to rock the boat like everything. I was just having
You
a
know,
conversation the other day about
sorry to
just
interrupt, but
simple stuff.
I made a mistake on that. University Health, it's .org. It's not .net or the UHKC.org. Thanks.
Yeah. So, well, thank you for getting his info there. All right. So the curriculum group looks like it's next. And that we had, you know, a good talk a month ago on that, but basically the lifestyle medicine idea at KU. It sounds like they're gonna kind of change their curriculum, and lifestyle medicine is going to be kind of a little more on the forefront going forward. So they're going to try to get a faculty position to kind of run that. And then at UMKC, we already got the bronze level, according to the American College of Lifestyle Medicine, and they're trying to keep working up on that and getting more and more pieces to get up to that silver level. And I think do we know if they got that scholarship or when they'll find out? I didn't know the answer to that, but I know they applied for the scholarship for that, for some funding through the American College of Lifestyle Medicine. I just didn't know if
I don't
they
have
get-
anything on that. I do know that I'm medical director of the PA program, and as you guys know, you came over and we were part of that audience. Sarah Cox, our PA faculty, who's in charge of didactics, is very interested in this. She wants to, you know, implement a formal curriculum this semester. All the best we could get done was taking a portion of a class that I teach, which is called Professions 1, and at least introducing the concept to our first year PA students, you know, about lifestyle medicine, attention to their own, you know, lifestyle, and keeping that in mind for their future patients, et cetera. But I do believe that's going to grow. Sarah is she's already a very good educator, but she's also getting her master's in health professions education, which also means that she has even less time than she did before, because she's in these graduate classes in addition to her day job. So things are happening, and she's on it, and I'm sort of on it, and so we're making some headway.
Good deal. Well, if you know, I did a talk just the other day for the PA students on sports physicals. So if
Oh, great.
you would like
Sorry, I missed you.
anybody,
I didn't hear.
oh, no worries. Yeah, I've done it for like 4 years now. But if you want to add any exercises medicine to that, I got a lecture on that if there's space for it. So an option.
Which was that the year one class, Jay?
Yeah, I think it was year one. Actually, I'm not 100% sure which year it was. I know Stephanie Painter, I believe,
Yeah, Stephanie was.
is
So,
who is running that. So I don't know if that helps you figure out which year it was, but
It's probably it's a module then, probably within what's called Science and Practice of Medicine S&P. Well, you may just want to send Stephanie a short email just expressing an interest in talking about exercise as medicine
Okay.
specifically. That'd be the best way to do that.
okay, yeah, I'll just send it on from what we talked about last week. So perfect.
Cool.
And then the other thing, big thing, which some people may be going to, again, I'm going to be in Colorado, so I'm not going to make it, but the American College of Sports Medicine Central States is going to be, I think that's Thursday and Friday, right? Thursday and Friday, 7th and 8th.
Yes.
On this week at Children's Mercy Research Institute. So if there's anybody who isn't already going who would want to go, they can still join in there and walk across the street from UMKC if they are available, or anywhere else in the city. Get over there. But yeah, that's going to be Thursday and Friday at Children's Mercy. So I don't know where everyone's going to park. We've been asking that question for a while, but it's set up, so it's going to happen. And it's the ACSM is more than just physicians, and that's kind of nice. I've been to a couple of their national conferences, and they get all sorts of allied health folks in a lot of basic research, athletic trainers, physical therapists, dietitians, exercise physiologists, and physicians, PAs, NPs, all that stuff. So it's actually a great mix of healthcare folks. So there's a little something for everybody usually at those meetings.
That was great. And that's a central region meeting.
Yeah, the central states. So I think that's Kansas, Oklahoma, and Nebraska, North Dakota, South Dakota, maybe Missouri too. It's
Probably Missouri and Iowa, I would guess. Yeah.
yeah, I think that sounds about right. But yeah. So sure Texas does their own group just because it's Texas.
Well, of course.
But yeah, it's the national meetings are interesting, and I've never been to one of the central states ones because I haven't traveled for those, but I'm sure it'll be pretty interesting over the next few days. And another thing that Shelly and I had been talking about, and we don't have like a concrete plan right now for it, but is doing some short videos for kids, some physical activity videos, maybe calling them brain break videos or something like that, that would be even ideally easy for a teacher to do in a classroom, just a little 10-minute, hey, let's get the wiggles out kind of stuff, or even go advanced from that and giving people some home exercise plans to work on, but thinking about 5 to 10-minute videos, ideally with, I think the best person would be a physical therapist to kind of be in charge of the exercise, a couple of kids in the video, and then ideally a Kansas City sports celebrity joining in, and getting kids to just do some simple, quick movements, just things that everybody can get done. Maybe do like a lower extremity video, an upper extremity video, a core video, an aerobic video, something like that. I think it could definitely join in several different sectors. So obviously healthcare, I feel like we would be in charge of it with our physical therapists and stuff, but also school sectors, we'd want some input from them. We would make sure it gets onto the Move Together KC hashtag and all the social media and communication stuff from the KCPA plan. And then Parks and Rec was another sector that we could potentially get in and maybe do it in a cool location at some different parks and around town. So those were some of the things we're thinking about, but Shelley and I have been talking about, I think we need to find out what we really think all that would cost, see if the celebrities, ideally we'd get ones that would donate their time and not ones who would require a fee. But if you want the really famous people that people might actually click on their video, maybe it would be worth it to do a fee. So that's an idea that we could use for some of these implementation project funds to go forward with that once we get a little bit better idea of what a budget might be.
Cool. I'll reach out to Travis and Taylor and get back to you.
Perfect. That would
Perfect.
be ideal. We can get a lot of people to click on that video.
They are two separate sports celebrities, though.
That's true. But if you put them both in the video, you get everybody.
You get literally everybody.
Mm-hmm. Jason Kelsey's retired. Maybe he'd come down and do it
Sure.
with his brother, and they could be the idiots on the edge, and then the kids are doing it right. It'd be great. It'd be high comedy.
Oh, that'd be cool. Yeah. I could see that.
I can imagine the costumes.
It'd be good. So that's an idea, and it's in the early stages, but might be something that we actually get going on. We've been talking about it for a while, but all right. I think unless anybody else has got anything they want to bring up, I know Katie can update us on when the next meeting will be and that kind of stuff. So
One thing just to have on your radar, and I think I mentioned this before, Lee Summit now has a wellness commission, of which I am a commissioner. And we're just really on our strategic planning. Who are we and what are we about, and why aren't we still in our separate boards that we're getting a lot of things done before we got combined into a new commission stage? Don't quote me on that. This is being recorded, isn't it? But anyway, it will be a good platform for, once we get that all figured out, it'll be a good platform, at least for disseminating information and things from all of the good things that you guys are doing. So in Lee Summit and beyond. So keep that in mind.
Yeah, and anybody from that who would want to be part of any of our sectors, we always take more voices, more brains.
You bet.
Yeah. Oh, I see. Sorry, Teresa, I just was looking at the chat. So how do we access these short videos? I'll share with the daycares, ECCs that I work with. What age group? So yeah, I mean the age group ideally, I was thinking kind of grade school, even potentially preschool, so kind of the younger kids. But we could make them. I mean, if that's successful, I think we could make videos for any and all ages. And ideally, we'd have some kids, maybe kids who are missing a limb or in a wheelchair or something, and have a modified version of some of those activities specifically for them as well. So we try to be pretty darn inclusive in those videos.
Do you know about, this is Teresa, do you know about Tony Temple? Do you know who Tony
Yes.
Temple is? We
Yeah.
have our big annual event that we host at Clay County Public Health Center. This will be our 8th annual year is Family Fun Day, and we do it down at Mackin Park and typically have over 40 vendors. He's been one of our vendors 2 years, and he does that animal movements,
Mhm.
short little gig.
Yeah.
But let me tell you, he rocked the park. We were drawing all ages, old people that were on the walking trail. If you're familiar with Mackin Park, it's one of our signature parks in the Northland, and it's just hard to get him. I know he's busy, but I think his main thing is he tries to negotiate with parents to do private one-on-one coaching with their kiddos, but he's dynamic if you can get him to respond to you.
Yeah, and we have a good in with him, Bill Brandmeier in our sports sector. He and Tony do a lot of events together. So that is definitely someone who I've thought about for that. So, but thank you for that suggestion. I'm glad to know that he gets everybody engaged really well when he's
Yeah,
out
all
there in
ages.
the group.
You're
So,
welcome.
yeah, yeah. All right. Katie, next meeting, I think you had it down as April 2nd. Is that what it looks like?
May 7th. So
Oh,
I
May,
think you
so,
might have been thinking
sorry, the
about,
curriculum, yeah.
yeah,
Yeah.
the next curriculum group meeting is April 2nd, but our next healthcare meeting is May 7th. But prior to that, oh, I need to grab the Eventbrite link. We do have a few announcements just related to some stuff from the Kansas City Healthy Lifestyles Collaborative. So we do have a quarterly meeting coming up. It is next week, March 14th. And whoopsie. Dr. Amanda Grimes, Michael Kelly. Dr. Amanda Grimes is from UMKC. Michael Kelly is with Bike Walk KC, and then Maddie Pia is with Children's Mercy. They'll be presenting on some of the results they found from a report conducted by citizen scientists around walk audits and bus stops. So that meeting will be at Shelley, I always just say Kaufman. I can't remember the rest. Where's the actual location? It's Kaufman, not performing.
It's the
Yeah,
Kaufman Foundation and Conference Center,
Foundation. Thank you.
not Kaufman the
Um,
stadium.
Yeah, I was like, it's not that. So here's the link to register for that. My apologies. The next announcement we have is related to State of Play. We have a summit coming up, so we've been working with Aspen Institute. As probably some of you are well aware of, for a while now, to collect some information around youth sports. And if you're interested in attending, I don't have a registration link, but I do have a flyer where you can learn more. So I'm posting that in the chat as well. There is a QR code to register though, so it is a QR code registration. I don't know, Jay, do you want to add more to that? I know you've been involved in that project.
Yeah, the Aspen Institute's really cool organization, and I've gotten to hear Tom Ferry talk a couple times. I don't think he's going to be there at the meeting, but yeah, they've been surveying all sorts of kids around the city, athletes, non-athletes, lots of schools, students, kind of get an idea of barriers to athletic participation. As we know, sports are beneficial for lots of reasons. And they're going to kind of prevent us with their overall findings at that meeting. And then ideally, because we're going to have a lot of sort of high profile folks there, Chiefs, Royals, charities, Sporting Kansas City charities, things like that, current, all those that we hopefully get some buy-in for some ways to help fix some of those barriers. And cost and transportation, unsurprisingly, seem to be, at least preliminary, they were high on the list of reasons people might not be as involved as they want to be. So yeah, I think it's going to be a good meeting, and it's been a big springboard for a couple other cities to really get some buy-in from the bigger players. Like up in Seattle, that got a lot of donations and collaboration. So I think it'll be an interesting report, and it'll be nice to see what comes from it.
Ed, did you get an invitation to that?
Is that what was just in the chat?
Yes. But you should have had an invitation that went directly to your email.
I don't remember seeing that, but oh no.
We would love for you to participate. It's Monday, April 8th. Same
It's
day as the
in-
solar eclipse.
Yeah, my kids were wondering if we were going to get to drive to go see that, and I said,
Hmm.
not me.
Well, I've got it on my computer screen now off of the chat, so I'll look that over.
Great.
And we'll see.
Okay, awesome. Well, I only have one more thing to kind of relate to everybody, is that if you weren't aware before, we've been working on for almost a year now a physical activity campaign with our media and communication sector. It's called Move Together KC. So within the last month, we started getting that launched, and we do have our social media up. So we would love if you would participate by following us. We are in the process of getting the community resources included to our website. So we do have a community campaign toolkit and a partner campaign toolkit. And this includes talking points and how to be more actively involved within this campaign, as well as a brand asset kit. So you'll have stock images, B-roll. It'll just guide you through the entire process of how to get involved with this new campaign. So keep an eye out, that is up and coming, and that'll actually be housed on the Kansas City Physical Activity website. But I'm gonna post our Instagram too. That is everything I have. Does anybody else have any updates they'd like to share with the group? Or Shelley, would you like to contribute more to our Move Together KC campaign?
Just be sure to follow us on social media, and we have opportunities for follow us, share this information. We're working first to get more organizations involved in using and promoting the Move Together KC campaign. And then we'll work to get in more individuals to participate through a hashtag move to blank. If you get a chance to look at some of the resources we have available, you'll see how our partner agency has been encouraging use of that slogan or that hashtag. So we encourage you all to tell your stories, submit comments, share with others, share your pictures. Tell the whole world.
I'm looking at the Facebook site right now, and it is, I think, just visually really, really great. Lots of color, lots of great images, photos of people moving and eating well. So good stuff.
One thing that most people won't know, that many of those, if not, I can't say all, but many of the pictures and video clips are people in Kansas City. Some
Awesome.
of them may not know they're included in this until they see those. So we hope that sparks a little bit of interest. We've let some of the people, some of our partners who are in them know that they are in them, and
That's
hope
great.
that they share them as well.
Perfect. All right. Well, we think are done with the meeting 12 minutes early, so that's nice. We hope that we'll see everybody back in May or the next meeting.
Sounds good. Thanks, everyone.
Have a great rest of your week.
Appreciate it.